Hi, everybody. Welcome to Nurse Table Talk. I'm Nurse Kathy.
Hi, everybody. I'm Nurse Julie.
So in our last video, Julie and I talked a little bit about chronic kidney disease and kidney failure. And when we ended the video, we thought, oh, we need to talk about dialysis. Now, we're not dialysis experts, but we can certainly help people understand what it looks like when you have to start dialysis. So dialysis is sort of when a person gets to stage 4 or 5 in the chronic kidney disease process. A lot of times their kidneys are just not working, and they're having a buildup of toxins in their system. They don't feel well. They're not able to function like they want to. And their doctor will say, you know, it's probably time to consider dialysis. You're at that point. So from that point, a lot of other things are going to happen. And eventually a patient is going to end up going to a dialysis center. And we kind of wanted to paint that picture for folks because that ends up being a lot of fear, a lot of stress, and a lot of anxiety. And we're hoping to alleviate that with this video. So Julie, why don't you kind of take us on an imaginary tour of a dialysis center?
Okay. So like Kathy said, my patients that I've talked to previously, they were overwhelmed with everything coming at them at once. And they were pretty freaked out, like, oh my gosh, I got to go to a dialysis center. What's that all about? And then, you know, they have so much information from their doctor and their kidney specialist, who is their nephrologist. And they just want to learn what to expect and not be surprised when they walk through the door. And my recommendation that I would always tell them is, have you considered taking a tour? Take a tour of a facility, find one close to your home, find 2 close to your home, and go tour them. Check out, you know, you walk through the door, you're going to see a string of chairs, the receptionist will greet you, and you know, you want to look and see, do they have a friendly staff? Do they have a smile on their face? Do they make you feel warm and fuzzy? Because you're scared, and you have every right to be. I mean, they're going to take that fear away from you, hopefully.
Yeah, and the apprehension. Yeah.
But yeah, take that fear away and hopefully help you feel less stressed and more relaxed. So there's going to be other staff members that you encounter. You'll meet with a registered dietitian who will help try to give you recommendations on your dietary management. They look at your labs, your potassium, your calcium, your phosphorus, your protein. If there's any restrictions dietary, they give you suggestions and help you learn what foods maybe to have or to avoid. So they're a wealth of knowledge as well. You'll have technicians that come to your chair and your side, and they're the ones that, you know, hook up the dialysis equipment. And I would want to ask them, hey, you know, how long have you been here? Have you done this a long time? Maybe ask, you know, the staff when you take the tour, just a general, you know, how long have your technicians been with you? You'll probably see a nurse, and Kathy, you can go ahead and talk about, you know, the nurse, the nephrologist, and case manager, and all those extra people. But really, you know, it will make you feel less overwhelmed.
Absolutely. So when a person has to start dialysis, they're literally at this center for 3 days a week. So that's why it's so important that you feel good about where you're going to go, because you're going to be there quite a bit. You know, it's going to be a huge priority in your life. So you want to make sure that it's going to meet your needs as best that any place really can, right? So in addition to the receptionist and the dietitian and the nurse and the technician, your care is going to be managed by a doctor called a nephrologist. And that person is going to be kind of like your primary person, because the rest of your care is going to be kind of dictated by this person. So the dialysis center usually has someone who is permanently on staff. If you're there and you're having issues with something, You need to tell the nurse you have access to a doctor right there. You don't have to make an appointment. They're already there. So that's the beautiful thing. So any questions, comments, concerns about how things are going, or new symptoms or questions that pop up, you have access to somebody 3 days a week to get those addressed. So we would strongly encourage that you to use those resources, because they're right there at your fingertips. The other people that are instrumental in your journey with hemodialysis are going to be your case manager or your social worker. It might be one or the other, and in some cases it might be both. But the general goal or job of those people is to make sure that you have the resources that you need in order to be able to successfully do the dialysis. Do you have transportation to the dialysis center? Have you made arrangements if you're not going to be there, if you can't be there next Tuesday and that's a regular day for you? Do they have a plan? Are they aware that you need to schedule change? Everybody who is on Medicare in the United States is also, everybody who is on dialysis in the United States is also on Medicare. If you're not on Medicare and you get an end-stage renal failure or kidney failure diagnosis, you need to be connected with a social worker or a case manager. That person will help you apply for your benefits. There's also coinsurance associated with it, because Medicare only takes care of 80%. So for 20%, for a lot of people, is a lot of money. The case manager and the social worker will help you find your coinsurance money, right. Grants, community-based resources, all of those other places. They know where to look that you don't. So you have a very comprehensive staff of people who are invested in your well-being. And Julie and I would strongly encourage you to take advantage of everybody that passes by your chair and try to get as many of your needs addressed. Don't let things fester, and don't sit there and worry about things. You have access to all kinds of answers. You just have to be comfortable and ask the question.
Right. And Kathy, one thing that I would stress to my patients that I would talk to is they would see people coming down the line, visiting other patients, and they get to their turn, and the staff would introduce themselves. Mm-hmm. But the patients would say to me, I don't remember if I saw a dietitian. I don't remember if I saw the social worker. I know I saw the nephrologist, but I don't remember anybody else. Right. And that's when I would say to them, stop, take a deep breath, and ask them again who they are. You can ask them each time you go in. Who are you
every
again?
Time.
Yeah, just be sure and ask. Don't be overwhelmed. It's hard to say that, not to be overwhelmed, not to have the fear, not to have the stress or anxiety, but ask these people their names. Ask them what they do. Repeat, because you will become more comfortable. You will get to know them. They will, call you by name and they're there to help. They're there to help. They want to make you feel comfortable, like Kathy said. It's a big deal. And so we just wanted to share this information, get it out there, and let you know that there's supports for you. So
absolutely.
And to be an informed consumer. So again, thanks for watching, and we'll see you next time.
Thank you. Bye now.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.